this is the Integrated Physical Therapy and Health Consultation video with Mary Catherine, who has cervical dystonia. So Mary Catherine, show me your cervical rotation. Just look over your shoulder. Just do what you can there. Good, and the other way. Good. Okay. And then back to the front, and then bring your ear to your shoulder. Cervical side bending, and then the other way. Good. And Mary Catherine is stiffer on the right side than she is the left. And then bring your chin to your chest, cervical flexion. And look all the way up and back. Good. And then come back to center. And where do you feel most of your pain?
This, and then right here.
Great.
Especially when I look up.
Okay.
When I put my head back.
All right, after the treatment, we'll remeasure and see the progress.
Okay.
Okay, now we're going to do the dry needling on the upper trapezius trigger point, which is right here in my fingers. We're going to go in and just insert the needle and piston it up and down right there in that trigger point to deactivate that. Mary Catherine's breathing. Take some deep breaths in and out. This is very tender on her. And we can do that throughout the whole trigger point area and in the scapula and down into the shoulder. When we dry needle the upper trap, we just tap the needle in and do a little pistoning up and down. And that actually causes the micro tissue damage that creates the healing process in the muscle. All right, this is Mary Catherine after our trigger point session, the needling session, and we did some soft tissue mobilization and some massage. So now let's see, look over your right shoulder. Good. And your left. Good, better.
Mm-hmm.
Okay, and come to the front, and then ear to your shoulder. Wow.
Yeah, that's a lot better.
Good.
It's much it's easier.
Feels better?
Yes.
Back to the front, chin to your chest. And look all the way up and back.
Oh, that's a lot better.
Great.
That's a lot. Yay!
Thank you. All right. So on a scale from 0 to 10, or let's do from 0% to 100%,
Yeah.
how much better do you feel just from this treatment?
I'd say, just from first walking in, I'd say 75%.
Wonderful.
Because I can even breathe better.
Good.
Because it's not, what happens is, it just feels like somebody's squeezing me in.
Mm-hmm.
So I tend not to breathe because I'm always fighting.
Right.
I mean, I breathe, but it's not I don't think it's a full breath. So this feels more open.
Great.
I don't feel like I'm doing like this.
Wonderful.
So, yeah.
Well, thank you, Mary Catherine. I appreciate you, and I'm so glad we're making some progress on your dystonia.
Yes.
And so, thank you.
Thank you.